Recovery is possible.
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 Recovery dialogues and sober stories.
Hello, everyone. It's Antonio Matta here, your host from seasons 1 and 2 of the Recovery Dialogues and Sober Stories podcast. As we gear up for an exciting season 3, I wanted to offer you some bonus content by revisiting one of our most impactful episodes, Mental Wellness Matters. In this episode, we sat down with 3 remarkable guests: Dr. Gabrielle Jones, a licensed psychologist and founder of Steady Clinical Consultation, Training, and Development Services, an authority on mental health and substance use; Dr. Justin Jacques, who runs a private practice at the Human Theory Group, a highly respected mental health professional passionate about helping people live their best lives; Allison Konovalova, an experienced psychologist with a thriving private practice at Mind Talk Healing, bringing a wealth of knowledge and expertise. We delved into the significance of mental wellness and the importance of integrated treatment for dual diagnosis. Their insights were invaluable, and I'm thrilled to revisit that conversation with you now. Let's dive back in and explore how mental health plays a crucial role in recovery.
So going to therapy is really going to help with that, right? And those character disorders or personality-related features often cause mental health concerns, which kind of domino effect into substance use-related concerns. If you're wanting to maintain sobriety long-term, I think it's essential that you're treating your mental health.
Ms. Konovalova, how can mental health disorders be a consequence of a substance use disorder?
Mental health disorders can be a consequence of having a substance abuse disorder because a lot of times when people get caught up in addiction, they lose their support system. Sometimes they lose their job or their home or their spouse or significant other. This can lead to a lot of anxiety or depression. And sometimes people overuse substances and then develop a mood disorder or something else, which can be a consequence of having addiction.
Can you explain what dual diagnosis means and what could make treatment for co-occurring conditions tricky or ineffectual?
Dual diagnosis simply means that you have a mental health condition and you have a substance use disorder. I would say the majority of rehab facilities do address both, but not all.
Dr. Justin Jacques and Ms. Allison Konovalova have discussed the bidirectional relationship between mental health disorders and substance use disorders, or SUDs, highlighting the need for integrated treatment approaches that address both mental health and substance use simultaneously. Research supports this, indicating that individuals with mental health disorders often resort to substance use as a form of self-medication. In fact, approximately 27.7% of the U.S. general population experiences comorbidity between these disorders, according to the Journal of Psychoactive Drugs. This high prevalence highlights the necessity for integrated treatment approaches that addresses both mental health and substance use simultaneously. Ms. Konovalova explained how substance use can lead to mental health disorders because many times when people get caught up in addiction, they lose their support system, leading to anxiety or depression. Her insight reflects findings from the Drug and Alcohol Review, which states that substance use can exacerbate existing mental health issues, creating a vicious cycle that complicates treatment and recovery efforts. Sometimes people overuse substances and then develop a mood disorder or something else, emphasizing how addiction can trigger new mental health challenges. Life stressors play a significant role in relationship between mental health and substance use disorders. Individuals struggling with addiction often lose their job or their home or their spouse or significant other, which can lead to increased anxiety or depression. This aligns with research from the International Journal of Applied Research in Social Sciences, indicating that the loss of support systems, employment, housing, and relationships due to addiction can indeed lead to the development or worsening of mental health conditions. Additionally, such losses can cause people to feel isolated and distressed, which may drive them to use substances as a coping mechanism. Dr. Jacques emphasized the importance of treating mental health to maintain long-term sobriety, highlighting the domino effect of substance abuse and overall well-being. The interplay between substance use and mental health is further complicated during challenging times, such as the COVID-19 pandemic. The Centers for Disease Control and Prevention's Morbidity and Mortality Weekly Report underscored the importance of comprehensive recovery-oriented practices that address both substance use and mental health, particularly when external stressors are highlighted. Treating mental health is crucial for achieving and maintaining long-term sobriety, as therapy can help address character disorders or personality-related features that may contribute to substance use. Research from the Journal of Dual Diagnosis indicates that integrated treatment approaches significantly enhance recovery outcomes compared to treating each disorder separately. Robust community support systems are also vital. The loss of support systems can exacerbate mental health issues and hinder recovery. Therefore, rebuilding relationships and providing social support can aid in both mental health improvement and sustained sobriety. Continued care and monitoring are essential to address the chronic nature of these disorders, ensuring individuals receive ongoing support beyond initial treatment. Dr. Jacques and Ms. Konovalova emphasis on the interconnectedness of mental health and substance use disorders aligns with findings in numerous studies supporting the importance of integrated treatment approaches.
There's a lot of evidence to suggest that can really help with energy and mood, right? Maybe it's getting natural sunlight early in the morning. Maybe it's doing hot, cold treatments, right? There's some really good evidence out there now that can help with increasing your dopamine and serotonin. Sleep hygiene. Sleep is so essential for mental health, and then as a result, recovery, right? And also social connection, making sure that those patients are really connecting with others. Other things that you can think about are like acupuncture and community-based sports, other things that can really help bolster serotonin, dopamine, even things like grounding techniques, getting outside, being in nature, right? These little naturopathic ways can gradually help increase dopamine and serotonin and overall mood as somebody's brain is healing, especially if they've been using substances at a really high level for a long period of time.
Dr. Jones, regardless of a person's diagnosis, what self-help strategies work well for people trying to maintain mental wellness?
This is a great question. I think there are several community meetings that are tremendously helpful to provide external support for people who are attempting recovery. A couple examples are Refuge Recovery, which is Buddhist-based. We have Life Ring, which is secular, AA, Alcoholics Anonymous, and various forms of 12-step programs. Celebrate Recovery, which is Christian-based. So there are all types of community meetings that people can engage in for their recovery. There are also, with technology being so advanced, there are so many apps that are out there for people to use.
Dr. Justin Jacques emphasizes natural interventions that can enhance energy and mood. which are validated by existing research. Exposure to sunlight and temperature therapies can significantly improve mental health, as morning sunlight exposure is crucial for regulating circadian rhythms, which can elevate mood disorders like seasonal affective disorder or SAD by increasing serotonin levels, thereby enhancing overall mental well-being. Additionally, studies published in Medical Science Monitor Basic Research have found that hot and cold treatments, including hydrotherapy and cold immersion, are linked to the release of neurotransmitters such as dopamine and serotonin, further contributing to mood enhancement. Sleep hygiene is essential for mental health recovery, with research showing a strong correlation between sleep quality and mental well-being. Poor sleep can exacerbate mental health issues, while adequate sleep fosters neuroplasticity and emotional regulation. These factors are essential for recovery from mental health conditions and substance use disorders. Social connections are vital for mental health, as community support and group therapies have proven effective in mitigating the effects of isolation and promoting recovery. Engaging with others promote emotional support and improve coping strategies, which are essential for individuals recovering from mental health challenges. Alternative therapies such as acupuncture, community-based sports, grounding techniques, getting outside, and being in nature can also help bolster serotonin and dopamine levels, enhancing mood and psychological well-being. Dr. Gabrielle Jones adds to the conversation by discussing self-help strategies, emphasizing the importance of community meetings and support networks. Engaging in group therapies and support meetings can help individuals feel less isolated and more understood, which is crucial for recovery. Technology, in addition to traditional therapy methods, can offer tools for mindfulness, mood tracking, and connecting with others, complementing traditional therapy methods. Ms. Konovalova, what advice do you have for those hesitant to seek professional help?
For those hesitant to seek professional help, I would say it's so worth it. If you're miserable and you can't stop using and your level of functioning has significantly gone down to the point where you're about to lose your job or your partner or your home, there are ways to get help. And not everybody has to go to a long-term rehab. You can start with therapy. You can start with the free resources that I mentioned, like a refuge recovery, or doing therapy and working with a therapist to have some accountability, depending on where your addiction is on the spectrum of how bad it can be. Obviously, if you're really functioning in a poor way, then you need to go to a rehab, and it's not the end of the world. And there are lots of good people who work in these industries and therapists and doctors who want to help you. And I have seen absolutely tremendous recovery from people from 1 month to 3 months to 6 months who are living lives that they never could have dreamed of living while using. And it's an absolutely incredible thing to see how powerful it can be and how different your life can be when you are free of addiction.
Ms. Allison Konovalova offers heartfelt advice to individuals hesitant to seek professional help for addiction. She acknowledges the struggle and emphasizes the importance of addressing barriers to seeking help, particularly the stigma surrounding mental health. Research indicates that stigma significantly deters individuals from pursuing assistance, and perceived social support negatively correlates with mental health stigma impacting help-seeking behavior. She reassures that professional help is accessible in various forms, such as therapy, free resources like AA or refuge recovery, and working with a therapist to have accountability community support groups. outpatient therapy, and online resources can serve as effective initial steps for those hesitant to enter long-term rehabilitation programs. Matching treatment intensity to addiction severity significantly improves outcomes, and offering alternatives to long-term rehab lowers the barrier to starting the recovery process. Ms. Konovalova also emphasizes the supportive nature of professionals in the field, stating that there are many good people working in these industries and therapists and doctors who want to help. A strong therapeutic alliance formed between clients and professionals fosters motivation, encouragement in treatment, and better outcomes. By highlighting the compassion and dedication of therapists and doctors, she helps reduce self-stigma that often predicts negative attitudes toward professional help seeking. She shares inspiring observations about recovery, stating that it can be transformative and lead to positive life changes. This affirms that recovery is possible and that quality of life can significantly improve, supporting the notion that multidisciplinary approaches in recovery are effective. Witnessing such changes reinforces the value of professional support and the impact it can have on individual lives.
If they're just looking for a community to go hiking with other people who are in recovery, or if they want to join a bicycle club or where they mountain bike. So there are several different avenues to build community. And I think that's the most important thing, is building community of individuals who are attempting to reach the same goal in life and in their recovery.
How can family and friends support their loved ones whose mental or emotional health may be suffering as they recover? What are signs that something needs further intervention?
It's always important to ask questions, be explicit. When you know you have a family member or friend in recovery, it's also really valuable if you're intentional about where you invite them. So if you are going to lunch, maybe go somewhere that is not a bar and pub, or that doesn't highlight alcohol as one of their signature beverages. So you may go to, or you'd be considerate of their dietary needs. People in recovery deserve the same consideration. Thinking about that when you invite them out.
Dr. Gabrielle Jones emphasizes the importance of community engagement in mental wellness and recovery, highlighting its role in social support and health outcomes. She suggests that belonging to a community can significantly buffer stress and reduce the risk of relapse, while social support positively influences health outcomes and treatment compliance.
Dr. Jones also emphasizes the need for active participation in communal endeavors, such as sports, arts, and volunteer work to foster connections and enhance motivation and accountability. She advises family and friends to be intentional about where they invite loved ones in recovery, choosing venues and activities that do not center around substances. Effective communication strategies are essential for expressing support without judgment, creating safe environments that minimize exposure to triggers, and supporting the individual's recovery journey. Dr. Jones's emphasis on being intentional and considerate reflects the need for mindful social inclusion practices, which can help reduce the risk of relapse and make the person in recovery feel respected and supported. This approach acknowledges that social interactions can either support or hinder mental wellness. As noted in research from Frontiers in Psychology, Dr. Jones emphasizes the importance of being observant and asking questions, as understanding emotional and behavioral indicators can prompt timely interventions. By being attentive, loved ones can identify early warning signs of relapse and engage in discussions about intervention strategies to empower themselves to act when concerning changes are observed.
That just about does it for this throwback bonus episode. I hope you found it enlightening. I want to extend my deepest gratitude to all of you, our devoted listeners. Your engagement and passion for the topics we cover mean the world to us and continue to fuel our mission to bring valuable insights and support to those navigating mental health challenges and recovery journeys. If you found today's discussion as impactful as we did, we invite you to help us make Season 3 our best yet. We've launched a GoFundMe campaign, and you can find the link in the episode description. Your contributions will help us produce even more high-quality episodes that delve into the heart of recovery and mental wellness. Additionally, if you're interested in sponsoring the upcoming season, please reach out to me directly. Your support will enable us to expand our reach and impact, providing more resources and fostering a compassionate community for providers and those affected by mental health conditions or addictions. Stay tuned for more bonus episodes leading up to Season 3. Together, we can continue this invaluable work, reach more people, and make a real difference in the lives of those who need it most. Thank you for being a part of our journey, and I can't wait to bring you more inspiring content.
Recovery is possible. Recovery is possible.
Recovery is possible.
Recovery is possible.
Recovery is possible.
Recovery dialogues and sober stories.